Good afternoon. This is Susan Eichhorst. I'm a physician associate here at BeSANA Health and Wellness. And today I'm going to carry on with our webinar series here at BeSANA Institute. I've been asked to talk about heart health, and hopefully we'll have a little bit of some entertainment, education, and something that's useful for you to start in your own health journey. So talking about keys to heart, I really wanted to start with there are other aspects of heart disease and heart health that I'm not going to cover today. What I won't be talking about is heart arrhythmias, these palpitations that people feel. We call those premature ventricular contractions, or PN. This is where you find atrial fibrillation, atrial flutter. So these are electrical impulse diseases. You also have heart disease that covers valvular disease, and this is mitral valve prolapse, aortic stenosis. That is not something we're going to cover today, nor infections like endocarditis or myocarditis. Really what we'll concentrate on is coronary artery disease, and that's what most people do think about when they think about heart disease. So coronary artery disease or cardiovascular disease really pertains to blockage of the arteries, and that decreases the amount of oxygen that is supplied to tissue and organs throughout the body. When that lack of oxygen is to the brain, that is when we call that a stroke. And that can happen with plaque that blocks off the artery, specifically something in the carotid artery or more internal artery, or you have a little piece of plaque that breaks off. Now it becomes something that's mobile through the bloodstream, and we call that an embolus. And that emboli can also block another artery further down, and that can result in a stroke. When that blockage is in the heart muscle, that's when you feel heart pain. That is myocardial infarction, lack of oxygen to the heart muscle, and we call that heart attack or an MI. Cardiovascular disease is not really the best descriptive for this condition, though, because it really doesn't affect these small veins. It doesn't affect veins at all, but it also doesn't affect small arteries or the arterioles. So it's really more of a hardening of the arteries themselves, and this is called atherosclerosis. Atherosclerosis came in as a term in the early 1900s as an accumulation of plaque within the arteries. And now we have further defined that to understand that there is calcified hard plaque, made up primarily of calcium deposits, and soft plaque, which is made up of more cholesterol deposits. And then calcified plaque is older plaque, it's more stable, but it can block off the blood flow, whereas soft plaque, as I said, is made up of cholesterol particles. It's newer, it's more fragile, it's more prone to break and bleed and travel to these small arterioles and cause a stroke or a heart attack. So why is this such an important issue to talk about? Well, coronary artery disease is actually the leading cause of death in America for both men and women. The average age of the first heart attack for men is around 65 years old. For women, it's a little older at 72. And there's over 200 million people living worldwide with coronary artery disease right now. Men more than women, but just ridiculous numbers. Here in the US, it's more than 20 million people that deal with coronary artery disease. And that wears down to 1 out of 20 Americans over the age of 20. Regrettably, of the people that do die of a heart attack, that death is the first sign that they even have coronary artery disease, and maybe their only symptom. Heart disease really hits women pretty indiscriminately. It is accountable for, it's the number one cause of death for women, and that puts it at about 1 out of 5 female deaths is accountable from a coronary artery disease perspective. It's a major factor in menopause because women lose estrogen, which is very cardioprotective, reduces allowing plaque to form. And also, prior to menopause, our bones hold on to calcium. Once we start to lose estrogen, we start to lose that capacity to remodel our bones, and we actually see more resorption and loss of the minerals that make it up, especially calcium. Calcium then is in the bloodstream more frequently, and now it can attach and accumulate around that soft plaque of cholesterol plaque and start to advance in the growth of calcium depositions. So we also see this in men, is their testosterone continues to lower. They have less of an aromatase or conversion of their testosterone into estradiol, and this then contributes to their growing coronary artery disease as they age. We have to start considering that what affects the heart affects the brain and other organs. So the most common site for atherosclerosis, or this hardening of the arteries, is in the coronary arteries, but actually the carotid arteries have a leading edge on that as well, and when those get blocked, that leads to stroke. You can have an accumulation of plaque in arteries that leads to the kidney, leading to a lack of oxygen there, or renal infarct and kidney damage. But this can happen in numerous places throughout the body where you then get lack of oxygen. Who's at risk for coronary artery disease? Well, certainly families give us a little bit of an insight. So if you have a family history of somebody that has a heart attack under the age of 50, for men, under the age of 60 for women is kind of the old adage, that does put you at a little higher risk for coronary artery disease. Our smokers, and especially our vapors, are at high risk because of the amount of inflammation that those chemicals cause. High blood pressure raises our risk of coronary artery disease. Drinking alcohol, regrettably, in almost any amounts or forms, is really not healthy for the body. Living a stressful life or job, regrettably, as most of us that live in a very stressful world these days, and our jobs are more stressful than they've been over the years. And then medications that were prescribed for other conditions can also lead to coronary artery disease. Specifically, many of our immune modulating drugs, Belzans for one, is an immune suppressing drug for many autoimmune conditions, but this does raise our risk of atherosclerosis. And we have seen an uptick in atherosclerosis, earlier heart attack death, and sudden cardiac death following COVID mRNA shots. But it all gets down to plaque. And plaque is really what starts to form in our arteries, blocking it off or causing this fragile plaque that can break off and travel to other parts of the body. So the irritant has to start from something, and that's usually a chemical. Cigarette smoke, foods can cause inflammation, other chemicals in our world, bacterial infections can cause this inflammation, and that causes our natural immune system to start a cascade or a whole event of inflammation. And really the idea here is to try to repair the inside lining of the artery. It's not causing harm, it's trying to repair the situation and protect that artery from inflammatory irritant. But if that irritant keeps going on and it's persistently exposing the lining of the blood vessel to this irritant, over time the response is the deposition of kind of a fatty, streaky cholesterol layer to protect the artery. And then that contains some calcium. And from there, without modifications in lifestyle or diet, these calcium deposits continue to deposit and build up in this calcium-rich matrix inside the blood vessel. It will then turn this soft cholesterol-filled plaque into a calcified plaque. And again, I mentioned earlier, calcified plaques are much more stable. They're older. They don't break off and bleed, but they will, in time, reduce the capacity of blood to get through that blood vessel, inhibiting oxygen, and then causing that ischemia or lack of oxygen to tissues. So it was really deduced, hey, this must all be cholesterol's fault. If that's the first thing that gets deposited in these arteries, it must come back to calcium. So what do we do about it? So back in the 1970s, it was believed that if we lower these cholesterol levels, and especially the bad cholesterol or the LDL, that everything will get better. And that's also when statin drugs were being introduced. And it was just kind of recognized, hey, we should just put them in the water for everybody. It was also strongly recommended that we stop eating saturated fat and we switch to a refined seed oil, or what we call vegetable fat. That's sunflower, safflower, corn, canola, or rapeseed oil. What's the word I'm looking for? Crisco. All of these were touted as very heart-healthy substitutes. And we were really encouraged to stop eating eggs or any animal products and to eat more carbohydrates and refined grains and sugars, as these would be healthier options for us. It's curious because back in the early 1900s, American consumption of butter especially was pretty high, at around 18 pounds of butter per year per person. And at that time, our heart disease numbers were really well under 10% as far as fatalities for Americans. Flash forward 100 years, now we're in the 2000s, butter consumption is way down to less than 4 pounds per person annually. Yet heart disease now tips over around 20% per person, or 20% mortality for Americans. Something doesn't fit there. And then you look at the French paradox. This is how we look at the French diet, which is very high in saturated fat. It's got a high cholesterol content. They smoke a little bit more. They live a more leisurely, less exercise-induced lifestyle. And they have a very low incidence of coronary artery disease and death rates from coronary artery disease. So what drives all that? They're eating all this good fat, drinking wine, eating cholesterol-rich foods, not having issues. Really need to look at what's the role of cholesterol. Cholesterol is important. It belongs there. It's made in our body. It's utilized by our body. When I talk about cell membranes, that's really the outer coating of the cell, and all the mechanism and the biochemistry goes on inside the cell. So the coating or the cell membrane is where things can transport from the outside cell into the inside, and waste products can get back out of the cell. Well, that whole cell membrane is made up of saturated fats, and specifically cholesterol. That's where receptors will sit, where hormones can dock and kind of engage with that cell to transfer the information that the hormone wants the cell to carry out. And if those cell membranes and those receptors are made out of garbage, such as bad saturated fats and very little cholesterol, they really probably do a pretty poor job protecting the inside of the cell from the outside environment. Super important aspect of the cell. Cholesterol is actually used by our body to make our sex hormones, estrogen, testosterone, progesterone. We really have a responsibility to maintain cholesterol so that all these other components can be made adequately. And when we do things to lower cholesterol numbers, we are also affecting the downstream hormones that are trying to be made. Cholesterol assists our adrenal glands from making their hormones, our stress hormones of adrenaline, cortisol. And even though we all vilify cortisol because it causes more fat to depose and is a result of more stress in our bodies, it's actually have it appropriately raised for stressful situations so we can get out of it. But then we also need them to kind of calm back down and relax again. And cortisol has to do with how much we make and how much we can recover from. Cholesterol is utilized in insulating our nerve fibers so that the nerve impulses can actually go from where they're initiated to the muscles or tissue that wants to innervate at the end. And cholesterol also assists the body in making bile salts from the liver into the gallbladder so that we can appropriately digest our food. Cholesterol is necessary for producing vitamin D3 in our body. The cholesterol in our skin interacts with the sunlight, which regrettably many of us don't see very much of, but then that helps convert into the hormone vitamin D3. Cholesterol is also very crucial for the metabolism of the rest of the fat-soluble vitamins, such as vitamin A, vitamin E, vitamin K, in all of its form, but specifically for us, vitamin K2. We are confident that now lower levels of cholesterol really do contribute to memory loss, and this is a worldwide problem that we are seeing with more levels of dementia being raised from insulin resistance, the use of these statin drugs and lowering cholesterol, the environmental toxins that are out there, and that is a whole different discussion. But we do want to keep cholesterol levels healthy for our memory. And then too low of a cholesterol has been associated with increased incidence of suicide. So we know that, again, these levels are important for all other downstream body functions and food control. The cholesterol studies are fairly solid. In Sweden, there's an interesting study that looked at a number of centurions living over 100, showed that these people had higher levels of total cholesterol as well as LDL cholesterol, the bad cholesterol. And they were all living over 100. Here in the United States, since the 1940s, in fact, 1948, the Framingham, Massachusetts study was started. The Framingham Heart Study, we called that, and that actually continues today to gather more information and data. And that has shown no real relationship between total cholesterol and death from heart attack within a 10-year period of time of testing. That was further supported in 1996 when one of the co-authors, Dr. William Castelli, he found that LDL, or bad cholesterol levels that were less than 300, really were of zero value in determining someone's coronary artery risk. And then more recently in 2016, Dr. Aseem Malhotra, who is a really interesting, very level, easy to listen to cardiologist out of the UK, he showed that actually higher levels of LDL in people over the age of 60 reduced all-cause mortality in the people that he was looking at. So we keep looking at the wrong marker. And why do we keep blaming cholesterol? There's so many other factors that affect us, but we keep putting it all on cholesterol. Well, in 2019, 5 years ago, 818 million prescriptions for statin drugs were prescribed worldwide. This was up almost double from 461 prescriptions written in 2008. So a little over 10 years, almost a doubling in how many prescriptions have been written for this medication. There are 40 million plus adults who are prescribed a statin drug every year. 10 to 20 of them report side effects. How many people never report side effects? How many people never take them or talk to their doctor about them again? And really, what are we preventing that we're causing all these side effects and people aren't even taking them? Why is coronary artery disease still the leading cause of death for both men and women? If this were cholesterol related, this should just be done. This is a non-issue. We don't have to worry about it. Mrs. Smith, you have high cholesterol. We'll put you on a statin drug. We will never have to worry about this again. But 3 years later, Mrs. Smith is deceased from a fatal heart attack. And we all wonder what happened because her cholesterol is normal. Why do we keep pushing this cholesterol myth, and where did it come from? When you look way back into the 1800s, Dr. Rudolf Virchow, his name is all over the medical literature, he first identified that LDL cholesterol is found within these arterial plaques. So that then started to be assumed that, hey, if there's higher levels of these cholesterol particles, then it's more likely that plaque will accumulate in these arteries. It will take much time to really find out that the total cholesterol and the LDL, they're not good predictive markers at all, and that lowering them is really not the answer. When we look a little further, we find a guy named Ansel Keys. And Ansel Keys was an American physiologist in the 1960s, 1970s. He was really looking at the influence of diet and heart disease. And he deduced that saturated fat raises cholesterol levels in the blood. And this is true. We know this for a fact. Since cholesterol had already been known to be associated with plaque, and it was assumed that higher cholesterol levels meant higher plaque levels and higher death, he started promoting that if we eliminated all these saturated fats from the diet, that this would not only reduce coronary artery disease, but it would just frankly disappear. That would be it. In fact, he was so bold to make a statement that said, if mankind stopped eating eggs, dairy products, meat, and all visible fats on meat, the coronary artery disease would become very rare. Period. That was it. There's no debate that studies show saturated fat raises serum cholesterol. And this line became heavily funded as the only dogma. But the big question remains, does it contribute to the heart disease and the dying from heart disease? In fact, in 2015, so less than 10 years ago, there was a meta-analysis where they gathered all these different information from different studies. And this was published in the British Journal of Medicine. And it stated that saturated fats are not associated with all-cause mortality, coronary vascular disease, chronic heart disease, ischemic stroke, type 2 diabetes. They just could not find a strong correlation for that enough to say that it's the saturated fat. But yet we keep perpetuating this myth. Even today, it's 2024, and this myth still prevails. In the 1960s and 70s, it was really hard to get funding if your studies had nothing to do with cholesterol. So they were really just thrown out. In fact, Ansel Keys had such a strong hold on the influence of the research money that he was able to rebuff the theories of British physiologist and nutritionist John Yudkin, who had found that actually high sugar intake was being correlated with heart disease. Yeah, no funding for that. Nobody wants to know about that. There was a Harvard professor named Dr. McCulley, and he was looking at children with high homocysteine levels. Homocysteine is a very inflammatory amino acid that humans make, but when it's high in the bloodstream, it really causes a lot of havoc, inflammation, irritation to the blood, the lining of the blood vessel. And Dr. McCulley found that these young adolescents that had high homocysteine levels then progressed to get early atherosclerosis and, regrettably, early coronary artery disease. He couldn't get any funding because there was nothing that talked about cholesterol in his research. And so that was really just rebuffed. And that went on and just kind of got lost for many years. And then eventually the sugar lobbyists petitioned some Harvard professors who were a little unscrupulous, and they were asked to find enough literature to support that saturated fat is really at the root of coronary artery disease and heart disease, and that we really needed to push for getting rid of saturated fat in the diet, go to a low-fat diet. And this is when the age of adding more sugar into our foods, kind of the snack well period that we called it in the late 70s, very early 80s, when we saw a whole change in our dietary structure. The food pyramid came out with, I think it was 11 servings of carbohydrates at its base. Today's is no different. In fact, if you look at the most current food pyramid, I kid you not, Fruit Loops and cereal are well above grass-fed beef as health healthy foods. So the cholesterol myth continues to be probably the most damaging myth of the 20th century to many of us that work in more medical wellness. The statement that high cholesterol causes coronary artery disease and statin drugs that lower cholesterol is the answer is just false. It has been consistent that at minimum 50%, but many studies will show 70% of people that experience their very first heart attack have normal cholesterol levels. Those are high levels of something that should just be done if that's the answer. So roughly half of the people with, and roughly half of the people with high cholesterol levels actually have very healthy hearts. They are not going to have any heart attacks. It's not going to ever be their problem. But cholesterol is a business. When you look at the science, there are at least 13 different subsets of cholesterol that we can talk about. LDL, HDL, VLDL, VVLDL. There's ones I'm not even familiar with. Essentially, in conventional medicine, we measure two. Well, we measure a total cholesterol and we break that down to your HDL or high density. These are more your floatable, good cholesterol. And then we calculate an LDL. You do a little more testing, you might get a VLDL, or very low, these little lipid particles. But really, we base our information and measure only two of these. Cholesterol drugs are a $13 billion a year industry. This is huge for the pharmaceutical industry. But curiously, cholesterol only makes up 3% of the arterial plaque. That's it, 3%. Now, that is the soft plaque, so that can make a difference. But if you have hard plaque and it's calcified, and that calcium makes up more than 50% of the arterial plaque, maybe we need to concentrate on something else as why and how to protect against heart disease and a fatal heart attack. And sadly, this is very straightforward and well known. Now it's understood. It is not out and understood in the community, but sadly, there is zero evidence that a statin drug and lowering your cholesterol will prevent your first heart attack. It's just not true. So what other risks are there with that statin drugs, and why would I want them? There's over 30 studies, even before the 1990s, that showed zero benefit from just lowering your cholesterol. Statin drugs result in more muscle weakness, more muscle pain, and fatigue for many, many patients. As I said earlier, 10 to 20% of people stop taking their drugs specifically for that reason. And who knows how many other people are just never refilling them, going back to their doctors or following up. So we don't even know how many more people are dealing with this. Statin drugs can definitely cause memory and cognitive issues, and they do contribute to dementia. They also reduce other hormones, which contribute to dementia when they are not optimized. Statin drugs absolutely deplete our body of a very essential coenzyme called coenzyme Q10, or ubiquinone. Ubiquinone is ubiquitous and used in every cell. Ubiquinone is a powerful antioxidant that is used for cellular growth and maintenance. It actually helps your mitochondria convert more into more energy from the substances that it gets. Everybody should be on at least 100 milligrams of CoQ10 every day, whether you're on a statin drug or not. Hugely helpful for your mitochondria. And you must supplement with CoQ10 if you are taking the statin drug. Statin drugs also raise the risk of type 2 diabetes by roughly 46%. That's just huge. So does anybody benefit from doing the statin drug? So middle-aged men who have already had a heart attack, they've already had a stent placed, had a coronary artery bypass graft done, or have some obstructing plaque known in an artery, they may be benefited to prevent their next attack. There's some studies that show that high level of plaque in carotid arteries may be helpful post-stent, calcium or post-stent. Calcium scores that are quite high, we'll talk about calcium scores in a moment, over 400, showing extensive calcifications, may have some benefit from a statin drug, as when these levels are over 1,000, there's a 20% risk of an MI or sudden cardiac death within a year. But who really benefits? Big pharma benefits, absolutely. So getting back to what's the hallmark of coronary artery disease, it's actually this atherosclerotic plaque formation. So it starts with some kind of an irritant. Something's causing the endothelium or the inside lining of the blood vessel to be dysfunctional, and it actually starts to leak some proteins, some inflammatory components. What can do this? Airborne toxins, they're all around us, even in our homes. People can have mold toxicity. Other contaminants in the home, our cleaning products, our personal products, what's in our water, those can be environmental toxins that can accumulate. Certainly, most of us would think cigarette smoke. Vaping, not so much to somebody who's around it, since there's very little environmental release, but to the person who's vaping. These then cause a stress on the arteries. We see this also in blood pressure when that's high. High homocysteine levels. Again, this is an amino acid that is typically made by humans. We need it. It gets recycled, or supposed to get recycled, into a system that helps us remove heavy metals from our body, methylate some of our vitamins, make some neurotransmitters, kind of detoxing our body in the methylation cycle. And when these homocysteine levels stay persistently high, they cause inflammation inside the blood vessel that can lead to the acceleration or the formation of plaque. And then probably most important, we get back to high glucose levels, high insulin levels. This all gets to the root of so many chronic diseases, and especially here in the United States. We are talking glucose, too much glucose in the system, followed by too high of insulin levels, leading to insulin resistance. So I just want to talk about plaque for a minute. Plaque comes in a couple of forms, and I've started to talk about this earlier just briefly, but there's soft plaque and hard plaque. Soft plaque is harder to see on imaging studies because it really doesn't capture a lot of calcium within the body of it. But it's more worrisome because it's more fragile, can break off a piece. That piece can float in the bloodstream, land in a small artery in the heart, and land in a small artery in the lungs, but more frequently in the brain, leading to a stroke, heart attack if that's in the heart. CT scan, calcium scores will measure the amount of calcium in the coronary arteries, but it doesn't capture how much soft tissue there is. But it's still a great measure for the amount of calcium. Calcified plaque can then be minimized and even preferably stabilized and hopefully minimized with the addition of vitamin K2. This has been talked about in other webinars, specifically at the D3K2 webinar. Vitamin K2 is pretty magical in my mind. It has a property where it can actually liberate calcium that has been sequestered or stuck in soft tissue and help get it back into the bloodstream. It then helps upregulate, increase the activity of hormones in the bone that then attract that calcium to be driven into bone, where it's remodeled into new bone. So vitamin D3, along with vitamin K2, is very healthy for bone health, but K2 also has a wonderful component because it is reducing that calcium burden in those vessels and in the plaque. Calcification is fairly common. We see this in CT scans in nearly a third of Americans over the age of 45, some throughout the body. Arterial calcifications, we see a calcification do accumulate in veins as well, although it's not as detrimental in veins as it is in arteries. So what's really at the cause and the root of all this plaque formation? You'll always hear us here at BeSANA Health and Wellness talk about inflammation, inflammation, inflammation. Second thing is insulin resistance, absolutely right behind inflammation. And what can help with these things is getting your hormones optimized. It's not just, I feel better. It's your body is working more youthfully and healthfully when your hormone levels are up. They help reduce insulin resistance. They help reduce inflammation as well. But inflammation is really what gets us started here, and probably the most cautionary food that any of us tend to have in our world are these highly inflammatory vegetable or seed oils. These things are killing us. We know this. We can look at longitudinal studies before they came on board at the late 1800s. We did not have some of the same conditions that we deal with today. So we really need to get these out of our diet. They're in almost all our processed foods. They're not human compatible. You know, it's really much better, and we'll talk about things to do to cook with butter and lard and tallow and ghee, high quality olive oil, high quality avocado. But please start getting away from these vegetable oils. They stay in our blood system. They incorporate into our blood vessel, to the cell membranes, and they can take a good 2 years for your bodies to get through them and get rid of them. I mean, you're stuck with them for a long time. Hypertension is the other aspect that we really need to continue to control and get that pressure off these blood vessels. It's as if somebody's standing on your garden hose all the time. The pressure is coming out of the higher force. It's putting more pressure on the tissue inside the vessel. And over time, that's going to cause more inflammation that the body has to repair itself from. Talked about it a couple times. I know everybody's pretty well versed about it, but you have to say it again. We got to quit smoking tobacco. Vaping is not a healthy option. Vaping is probably even worse than tobacco. But these two components are really garbage. Something that most people never think about are root canals. Root canals are when we take the pulp and the root out of a mature tooth. pack it with some kind of a filling. Regrettably, we can never fully sterilize the tooth. That can breed all sorts of bacteria. That bacteria that can then travel to the heart, and that can be the foundation for the inflammation that allows the plaque to form. I have seen a few studies where they've been able to source back the bacteria in the plaque back to the bacteria that was found in a root canal tooth. And those were the only two sources of this bacteria. So that got seeded from the tooth into the heart and caused that plaque to form and resulted in a heart attack or plaque formation. So that is something to consider if you need a root canal. And then the ever-present stress. Stress is just stressing us out. We all need to learn to figure out a way to manage our stress and live in this world a little more comfortably, because literally it's killing us. Acute stress can be a real problem. I had started to do this webinar back when we did the time change. We had some audio problems, but that's why I also brought this up. It's a major stress for many people, myself included. I usually go through a big week that I'm not sleeping well, I'm a lot crankier, I just don't feel good after that springtime change. New England Journal of Medicine actually showed a study that there's a 24% increased risk of heart attacks on the Monday after that spring time change. So it's time to get rid of that. But also, if you know these risks, then do some things to mitigate that when that time comes around, if we're still doing that next year. Acute stress is really problematic, but chronic stress continues to keep an elevated cortisol level. And then that contributes to this visceral fat accumulation. Visceral fat increases your risk for insulin resistance and obesity, which then in turn results in inflammation. And we've got this downward spiral into coronary artery disease. Chronic stress also results in more alcohol intake, poor dietary and lifestyle choices, and it becomes kind of a round robin in that situation as well with stress. So what we're looking for is really to reduce stress, reduce inflammation through dietary changes, and look at hormone optimization. So we want to look at replacing estradiol, testosterone, and progesterone in women and men who have gone through some andropause or menopause, and restore those levels back into levels that we had in our late teens and 20s. A lot of argument against this. Hey, you're 60 something now. Why do you need the level of a 20-year-old? Because that's when we were healthiest. And we probably need the healthiest push when we're in our 60s and 70s than when we're in our 20s and our bodies are doing all that work for us. So we really want these levels optimized to where we were in our youth, not to make them more normalized for our age. It's important to assure that thyroid is also well regulated and that you have enough iodine and selenium to help that thyroid make its own thyroid hormone. Iodine and selenium are utilized to convert T4, inactive T4, into usable T3. There's a whole other thyroid webinar if you're interested in getting into more depth there. And iodine is actually used to make the hormones themselves. Whenever we talk about T3, that is a tyrosine amino acid with 3 iodide molecules attached to it. So if you don't have enough iodide in your diet, which it's hard to get, that's mostly seaweed, maybe some iodized salt, not much in there, then your thyroid doesn't even have a chance to make its own thyroid in adequate amounts. But today's day, we probably need to supplement that with a good supplement to bring that T3 up. Elevated levels, or optimized levels rather, of T3 can help improve the size of inflammatory LDL particles, but it can also reduce plaque in the arteries themselves. You want your vitamin D3 level in the high end of the range, between 50 and 90, because this does help with your immune system, helps with the sequester of that calcium, getting it into the bone instead of the arteries, and is helpful for hormone optimization. And then you want a low cortisol level with respect to stress management, but also adding good Celtic sea salt and mineral intake will help to lower cortisol levels. Insulin resistance, this is the big guy. This is what's responsible for so many chronic diseases that we've kind of not had a good root cause for explanation for in the past. But insulin resistance really leads to arthritis, hypertension, cancer, dementia, certainly diabetes. This is the case of high glucose intake that then results in a high blood glucose level. This is from our high processed carbohydrates and regrettably a low fat diet. This is what's been sold to the American public for the last 40 years, and what we are trying to revert back to a more whole food diet that diminishes the amount of glucose that's taken in and lowers the amount of high insulin rises that present during the day. Because as insulin rises to get that glucose out of the bloodstream, because it's toxic. Glucose is toxic to the blood. It needs to be in the cell where it can get utilized. Regrettably, once that insulin is pushed into the cell, if your insulin remains high, insulin's also toxic to your blood. Your body's going to try to do something to adjust this. Either make you go into a coma, have cravings to get more sugar in there, but insulin in and of itself can damage the endothelium when it's persistently high. So this damage is going on consistently between high levels of glucose by high levels of insulin, levels of glucose, and it just keeps again. You've got this round robin effect repeating these cycles, and it goes on and on. So persistently elevated levels of insulin lead to elevated inflammatory markers. This raises blood pressure. It increases visceral fat, increases the risk of fatty liver, increases cancer and dementia, all the way down the line. So if you keep your insulin levels low and stable, you can avoid most, if many, all of these guys as you keep getting older. Preventing insulin resistance alone prevents roughly 42% of all the heart attacks out there. They're that intimately related. And currently, we really only measure hemoglobin A1C. Hemoglobin A1C looks at kind of your red blood cells over the course of a 3-month period of time. That's kind of how long they last, or they're good for. And we look at the percentage that's damaged over the period of that time by high glucose levels. So it gives me a good measure if you're pre-diabetic or diabetic. But we may not be checking insulin levels, so you may never convert over to diabetes. But if you have high insulin levels, all those same damaging diseases are forming, just not without the disease process called diabetes. And then the major point from a provider and a patient perspective is understanding labs. Normal labs are not optimized. When you look at a lab value on a Quest lab, I think I have this right. I think Quest's labs say that your fasting insulin is normal if it's less than 9. I've seen other laboratories, maybe Access, that says 15. Can't remember if it was LabCorp. Somebody had an insulin less than 25 is okay. But the insulin experts out there, the anti-diabetic, anti-dementia, anti-chronic disease, functional medicine, integrative medicine, Ben Bickman, Jason Fong, Mark Hyman, Dave Perlmutter, all these experts, fasting insulin should be less than 5. Very different levels than your doctor may be aware of, very different levels than the labs say is okay. And I think this is a major component on why we have so many issues out there. So what kind of lab test do you want to get done? Well, your basic CBC and chemistry can be helpful. Total cholesterol can help because it'll give us our triglycerides and HDL. Calculated LDL might be helpful. But really, it's the triglyceride and HDL ratio. You want that less than 2. That's almost a great indicator that you do not have insulin resistance. Not perfect, but pretty close. And then you want your fasting insulin between this 2 to 5 level, not these low, ridiculous levels that Quest and LabCorp will post. Homocysteine, you want much lower than the reported labs, more like 6 or 7, not 10.4 or 15 as some labs. And when I do find a homocysteine level is elevated, I then look for the gene that's responsible for that, and that's the MTHFR gene. Different webinar, but we'll go into that somewhere else. And then we also like to look at a high sensitivity CRP or a marker for inflammation, and you want that lab test less than 1. If you want to get a little more in-depth with a cholesterol panel, you want to look at something called an NMR particle test. That looks at the LDL size and number. You want large, big, fluffy LDL particles, not small, dense ones, because the big, fluffy ones are a lot less harmful to the blood vessel wall. And then you can measure oxidized LDL itself. These are the particles that are most damaged by oxidation. ApoB measures actually these number of ApoB particles, which then become an LDL particle as they grow up. And you want these to be on the low side. The last test that I would recommend is an Lp(a). This is more genetically driven and not easily modified, but you can modify the particles that come from Lp(a) with high doses of niacin. Again, whole different webinar to talk about niacin's benefits. So what are really our best predictors from coronary artery disease? I kind of kabashed some of the cholesterol stuff, but really you want a fasting insulin less than 5, a low homocysteine of 6 or 7, a low high sensitivity CRP, triglycerides less than 100, HDL over 50. because high triglycerides themselves raise your risk of coronary artery disease by 16 times. Triglycerides are really impacted by sugar, glucose. That includes our wine, carbohydrates, anything processed. All of those can affect your triglycerides. And then how about testing? So there are some imaging testing that we can do, EKG or electrocardiogram. That measures really the electrical impulses or conductivity, not as helpful as a screening tool for coronary artery disease, with the exception of diagnosing an acute heart attack versus an old heart attack. But it doesn't really give us much information towards your risk or show that you have any asymptomatic blockage. It's really best for showing arrhythmias. A carotid intima media thickness test can be helpful because this is an ultrasound that looks at your carotid arteries leading up to your brain. That can measure the thickness of the arterial wall, and that gives us a good impression of the wall thickness versus the thickness of plaque on top of it. Many of these modalities can actually then quantify, is this soft plaque or hard plaque, because that can make a difference on management afterwards. Frequently, these tests are not covered by insurance for some reason, but they're fairly inexpensive, and we can always order them ourselves, usually to the tune of about $125. The other one that I highly recommend is a calcium score, a coronary calcium score, also known as a CT calcium score. This is a special CT that just looks at your heart, looking at depositions in the heart, looking for reduced blood flow through the heart. It's scored on a 0 to 1,000 type of a gradation. 0 is no calcium and a very low risk of a heart attack in 5 years, and then it moderates from there. So 100 to 300, kind of moderate plaque, relatively high risk for an MI in 3 to 5 years, and then a high risk if it's over 300. Again, as I said, these are not usually insurance, but are well worth your money well spent. You can also ask for a CT angiogram. CTCA is another word for that. And here we inject dye or contrast into a vein and watch this intravenously light up the arteries to the heart. It again does not distinguish between calcified versus soft plaque, but you can now have that CT angiogram put into an AI-driven CT or a computer program that will generate a 3D model. And now they can manipulate that and quantify the amount of soft plaque and calcified plaque, which then can help a provider give a little better idea of how do we want to minimize this and what's recommended. So what do we want to avoid? Well, cigarettes. Just don't start smoking. Please quit if you are smoking, and stay away from secondhand smoke. None of it's good for you. Regrettably, alcohol. Alcohol certainly moderates your intake, but honestly, the level of alcohol is healthy. Almost all of our California wines are contaminated with glyphosate now. We know that this inflammatory component, our body has to clear alcohol before it does anything else. So I really just encourage people, it's just time to just reevaluate how important is alcohol in your life. We have to get off our tushes. I sit way too much at work. We've got to get off these sedentary lives. We used to walk a lot more, had more physical jobs. That is absolutely contributing to our heart health. Avoiding ultra-processed foods is an absolute must if you want a better health journey. These foods are just poisonous on way too many levels, and our hearts are taking the brunt of it. That definitely includes all American wheat, corn, soy, and most dairy products, because they are all highly inflammatory. Our American commercial wheat, corn, and soy are all sprayed with Roundup. They're sprayed and fortified with folic acid that many of us do not process well and do poorly with. And our dairy is really mostly A1 protein cows, which are also highly inflammatory. What else to avoid? Unfortunately, protein in most restaurants. You don't know where it came from. You have to assume that it's commercially raised, unless they are really putting out front that this is a wild caught salmon, that this is a pasture raised chicken or egg. You're going to pay more for it, and believe me, they will let you know what you're paying for. So most of the experts that I follow, they just don't eat any protein in restaurants unless they can source where it came from. Again, it's these fortified foods that we have to avoid, and specifically the Roundup or glyphosate and folic acid that's really harmful. Pretty much anything, artificial sweeteners, chemical, fragrance, natural, anything, all of these are all chemical based and definitely resulting and contributing to our inflammatory states. And then I'm getting back once again, I know I'm repeating myself, but these hydrogenated seed oils are really garbage. They are incorporated in our body. They take years to get rid of. They are harmful. They're responsible for way too many chronic conditions. We just have to stop buying them. I do want to take a minute to talk about calcium because so many people are pushing to have extra calcium in their world, especially for menopausal women. Regrettably, calcium, especially when we supplement with it, it has no idea where to go. It doesn't just go to your bones. It tends to accumulate in tissue that it's easiest to accumulate in, and that tends to be our soft tissue, like our arteries. So it has been found that people who consume more than 500 milligrams of calcium a day, I believe that's a Tums, had a 27 to 31% higher risk of a heart attack and a 15 to 20% higher risk of stroke long term. That has to do with this calcium deposition. It's just not needed. Calcium raises blood pressure. It's even a common blood pressure medicine to make a calcium channel blocker. It blocks the amount of calcium that can get into the cell, keeps it outside the cell because calcium inside the cell is harmful to the cell, drives all these other issues to happen. So you really want to make sure that you are avoiding extra calcium in your supplements, that you are not overloading with calcium, not taking calcium supplements for your heartburn in the form of Tums, and getting all this extra calcium that may actually be hurting your heart and not even benefiting your bones. Calcium depositions are also precursors to cancers. If you look at mammograms and women's health, we look for calcification depositions in these mammograms because we tend to find associated cancers with them. So if you remove the calcium, and I mean out of the diet, out of that deposition, that removes that progressing into a cancer. You get plenty of calcium in your diet. Eat more leafy greens. There's zero benefits from calcium supplementation, and we need to get that information. You want to optimize your hormones. These will help reduce your risk of cardiovascular disease when your estradiol, testosterone, progesterone, thyroid, and vitamin D levels are all in the optimal range. BHRT helps with that to get estradiol levels raised back in women who are menopausal and for men whose testosterone has diminished. We need to continue to reduce all the outside sources of these estrogen sources. That's your phytoestrogens, your xenoestrogens. Those come from the chemicals. The other come from plants. They fit in the estrogen receptor and they kind of mimic estrogen. We blame them as estrogens, but they are not estradiol. They are fake and they are harmful. We need to get these low suboptimal free T3s raised because then that helps decrease the accumulation of arterial plaque, and getting optimal levels of D3 and K2, again, mobilize calcium out of soft tissue, get it into the bones where it can be utilized. How else to reduce your fat, your risk? Eat real food, organic, high quality, high fat, low carbohydrate. Breathe clean air, get outside, walk barefoot on the grass and the ground. It's called grounding. It actually helps to disperse some of our electrons out of the body that we accumulate from our phones, from the radiation in our environment. We need to change our air filters frequently so we're not getting all the contaminants in our air, where we can actually filter that out in our house. You have no control outside in the world. You have a lot of control in your house. And then drink purified water. Get a good water filter, Berkey filter, whole house reverse osmosis, a Go Pure. It's a great little pod you put in a bottle of water. Pulls out all these extra chemicals to help get your water clean. Most people don't know that there's byproducts of birth control pills in our water, other pharmaceuticals. There are microplastics in our water. We need to filter this out so it doesn't become part of our body and disrupt our inflammation cycle. Drinking hydrogen water can be really helpful to get better oxygenation and hydration to the cells. And then carbonated filtered water is a great alternative to sodas. What do you eat? Eat proteins. Get high quality, 100% grass-fed, grass-finished beef. Look at your meat. Make sure it is high quality. You want to make sure it's on a restorative farm. It's 100% grass-fed. It tells you it's grass-finished. The marketing is absurd out there on what they can get away with. Look for chicken that is only pasture-raised. Still don't eat too much chicken. It's high in omega-6 no matter how it's raised, but specifically when it's commercially raised, it has even higher omega-6s. So you really would be better off to stick with high-quality beef, bison, and pasture-raised eggs. Great source of protein. Pasture-raised eggs are the best. You can eat 4 or 5 of them a day safely and really have no impact on anything but good health. You want to look for pasture-raised pork with no nitrates, and then, of course, wild-caught fish, but I really caution people about fish, even when it's wild caught. They've released some of the farmed fish into the sea, so some salmon have spawned with these and have kind of hybrids. But also, the farming industry is bad, and we even have contamination in our wild caught fish now between plastics and just contaminants. So what do you eat? Again, 100% grass-fed beef, butter, ghee. You want beef tallow, you want lard, extra virgin olive oil. Be very selective with this. It's heavily tainted, different blends. Pay good money, know where it's from. You want a single source from a single country. You want to know when it was pressed, not when does it expire. Don't buy it in big quantities. Instead, use a high quality avocado oil, same instructions with that, or an MCT oil, medium chain triglyceride oil, or high quality coconut oil. All of those are much better saturated fats. We do need exercise. You need movement, some weight training. The best time to do a little exercise is take a walk after you have a meal. This mobilizes that glucose, gets it into your large muscles to use, and all you need is a steady pace to do that. High intensity interval training can be really good for some cardio sessions. Really, cardio workouts really cause a lot more inflammation, raises cortisol, especially in women and perimenopausal women. You're better with a good swift walk and some good weight training. I love the rebounder because it's great for lymphatic drainage. It's easy for joints. It's good for balance. It's really beneficial overall. You don't even have to do a lot to get a great amount of benefit. And then really more gentle workouts like yoga, Pilates, Qigong, Tai Chi, any of the martial arts, weight training, all of those very different types of spectrum on what you can do with them. Low impact, a little more intensity with great results that you get from those modalities. And then lastly, let's just talk about a few supplements that could really be beneficial for reducing your risk. You want a good omega-3. You really want a high quality fish oil. This gives you a great DHEA, EPA ratio. About 1 to 3 grams daily is preferential. Magnesium is another supplement that's really under-recognized and very diminished in most of us. Magnesium glycinate is probably the easiest tolerated, along with malate and threonate. At least 400 a day. You want this in divided doses because it is utilized in stress, and so you can use up a lot of magnesium pretty quickly and just not have any back in reserves. So if you keep supplying that, it works as a vasorelaxant and is used in over 300 different reactions in the body. So magnesium is important for all of those. Make sure you are getting good, adequate vitamin D3, K2, and have your levels checked. It is not enough to just take vitamin D3. You want to get that level checked to make sure it's in the optimal range of 50 to 90. Berberine acts as a great GLP agonist. That's what semaglutide is. Helps for reducing glucose levels and, importantly, stabilizing insulin resistance. So big fan of berberine, fan of nitric oxide. You can get this in tablets. That's a vasodilator. And I'm a big fan of niacin. Niacin just needs a lot of discussion because of the vasodilation of it and the flushing. But in high doses, 1,000 milligrams to 3,000 milligrams in divided doses, this raises HDL, lowers triglyceride, lower LDL, increases NAD, which increases overall ATP and energy in the body. Niacin has really got some great options for health. Magnesium, just to hone in on that, named after a city in Greece for its fertile cropland. Shows how important this is. It's stored in the red blood cell. And we really need to check your magnesium RBC level, not your serum level. Easily and quickly depleted from the bloodstream by stress. That's why we need to replace it. Used for over 300 chemical reactions. I think that's under-recognized, really underplayed. And it actually enables humans to convert plants and animal energy into our usable energy. It's a smooth muscle relaxant, acts as a calcium channel blocker, so it lowers blood pressure and also lowers intracellular calcium, which can be so harmful. Acts as a detoxer, and it's a precursor to glutathione. Helps to regulate blood sugar and reduces stress and aids in restorative sleep. Different forms of magnesium. The threonate crosses the blood-brain barrier pretty easily, but it's a lot more expensive, but really good for cognitive repair. The glycinate malate forms act as relaxation with very minimal GI effects. Citrate's best if you have some constipation, and you can dose that to where your stools are a little looser and comfortable to pass and then back off. You can mix these forms. You want at least about 400 a day, but you do want magnesium in divided doses. Can never go wrong with a magnesium Epsom salt. D3, K2, I'll just breeze over these because we've talked about that. K2 is heart protective. K2 is very safe and effective in low levels of 100 to 500 micrograms, but equally safe in high levels and is known to be a very effective treatment for osteoporosis in very high levels of 45,000 micrograms or 45 milligrams. Niacin, I want to do a whole nother talk on this. If you're going to go into niacin, expect that it will cause flushing. It can be bothersome, but is usually tolerated if you continue with doses. Best if you do it with a meal. Regular or plain niacin is preferential. It's the cheapest, it's the most effective. You will get used to it. Usually you want doses anywhere between 2,000 and 3,000 in divided doses, but even 500 milligrams a day is beneficial. We covered the best predictive markers. That's your homocysteine, inflammatory markers, fasting insulin. We've got to get this ordered. Free T3, got to get that checked, not just a TSH. Then we talked about the imaging studies that regrettably come out of pocket, but are really beneficial. What's the easy 1, 2, 3 take home? Eat food, not too much, mostly plants. That's Michael Pollan. Great guy. If you've never read any of his works, I would start with the Omnivore's Dilemma. Talks about how to eat a better healthy diet in this omnivore world. Eat organic vegetables. Eat more berries or fruits that end in berry. Please spend more money and get 100% grass-fed, grass-finished beef. Clean air. Drink filtered water. Avoid contaminated food. Get out in nature. Take a walk. Go hike. Go bike. Go walk barefoot. Yoga. Deep breathing. Work on your community. The blue zones live so long because of their community, not just what they're doing. Gratitude, giving, all of these things are what make us a better human, but also lower our inflammatory markers and make us healthier. Our bodies are designed to heal. They just want to repair. If we give them the right nutrients and remove irritants, you can reverse nearly all disease and prevent most of the rest. Family history is just that. It's your history. It's little orange flags. You get to build a new body. You get to take the positive steps to make that work. There's tons of references out here, you guys. I certainly love to read through these. You don't have to get as nerdy as I do, but there's a number of books and articles that go through the cholesterol myth, give you a lot more information than I have here. It's a great resource on this. He has written a number of books about the cholesterol myth, how to get better cardiovascular health, more nutrition and integrative methods. A Statin-Free Life by Dr. Mill. I love the book Undoctored by Dr. William Davis. Death by Calcium, anything Tom Levy's written. He's an MD. He happens to also be an attorney, but he's a cardiologist that has written extensively about calcium, about magnesium, root canal injury. Really love anything Dave Asprey brings to the table. He's a self-made biohacker and has done just great things for helping us understand better physiology and helping improve our health. And then one of my favorite books recently was Niacin, The Real Story. Dr. Abram Hoffer was a psychiatrist who did a lot of work with psychiatric issues and niacin, but also we've pulled in a lot of information of heart health and the use of niacin for that. So hopefully this has been helpful. I hope you've had a little bit of enjoyment. I know it's a long and a lengthy lecture, but I really just want to impress that heart health is not as straightforward as getting a cholesterol test, putting a lot of medicine, and waiting until something happens. We need to be a little more proactive. My philosophy is my patients get to be empowered to learn a little bit more, to learn what they can do to offset their risks for health issues as they get older, to prevent them, and to take positive steps to make sure that they're aging in the best way that they can. Please reach out to anybody here at BeSANA Health and Wellness if you think that we can be of help. And I really look forward to going through another webinar sometime together in the future. Thank you so much. Bye-bye for now.